So um, okay, let us start the class. Okay, health education. The topic is on health education. So, health education is a term commonly used and referred by a health professional. Okay, health education is indispensable in achieving individual and community health. Health education is a translation of what is known about health into desirable individual and community behavior patterns by means of an educational process. And the definition was given by John M. The process by which individuals and groups of people learn to behave in a manner conducive to the promotion, maintenance, or restoration of health. So, what we understand about health education is that health education is nothing but educating the people, okay, or a group of people, or or individuals living in a community, okay, whatever health issues that they are having, whatever education, basic education that they need to have regarding the various diseases, that you should deliver to the people, okay, because there are many people who doesn't know the preventive measures, okay, the curative measures, the promotive measures. So you will have to educate about all of those things to the people in general, okay. And one definition was given by this person, okay, John M, that it is the process by which individuals and groups of people learn to behave in a manner conducive to the promotion, maintenance, or restoration of health. How to promote good health, okay, how to maintain the health of an individual being, okay, or how to restore health. How to restore health means you have already learned about immunization. I already taught you on that topic. So how vaccination is important for infants, how vaccination is required to prevent us from various kinds of infectious diseases. So all this to mother MCH, okay, mother and child health. You have to give education to mothers, okay, to breastfeeding mothers, to mothers who have not, who are pregnant, okay, or all those infants who are newly born. So the vaccines that should be given, okay, the measures that they should take. So all this small health education you should give to the people, and for that you should have knowledge also, okay. Without knowledge you cannot give health education to the people. Okay, just speaking nonsense things, it won't help you. Okay, whenever required, you should speak, and also whatever you speak, it should be for the promotion, for the promotive measure of the people or for the individual. Okay, and for that you should have knowledge. So, any combination of learning opportunities and teaching activities designed to facilitate voluntary adaptations of behavior that are conducive to health. Any combination of learning opportunities means any kind of learning techniques, or if you are uh, providing education to the people, to the rural people, then you should use some audio visual aids, okay, that we have already talked about. Okay, you should use AV aids, like for example chart papers or flip charts, okay, or you should use posters, so that by seeing the pictures they will be able to understand more clearly. Okay, and for that you should use your teaching activities should be facilitated for the knowledge and easy understanding of the common people. Okay, and in the National Conference on Preventive Medicine in the United States of America, what does it say? It defines that health education is a process that informs, motivates, and helps people to adopt and maintain healthy practices and lifestyle, advocates environmental changes, as needed to facilitate this goal and conduct professional training and research to the same end. So in the National Conference of Preventive Medicine, okay, preventive and social medicine in the United States of America, what did they define health education as? They defined that it includes motivation to the people. Okay, it gives motivation to the people. It provides general information to the people, as well as it also helps people to adopt and also maintain a healthy lifestyle. Okay, and also it leads to environmental changes that will ultimately lead to certain goals like, for example, if I give you the example of diabetes, if somebody in the community is suffering from diabetes, so what are the basic health education or basic health tips that you should give to the people? For example, if and one more example, tuberculosis. If somebody is suffering from tuberculosis, okay, so what are the preventive measures that you should teach to the people? You should say, you should motivate the people, and your basic goal should be vaccination. Okay, vaccination, like for example, tuberculosis, when the baby is born, okay, within 24 months of age, the baby should be given the vaccine on BCG, which I already taught you before. Okay, bacillic amalgamatic urine. So you have to give that vaccine to the baby. I am intramuscularly in the upper arm. Okay, so as to prevent the disease, that is TB. So these are some of the things that you can educate to the people. Okay, in a simple language, in a simple way, you should educate to the people so that they can understand what you are speaking. Okay, because they are, you already know, you already have a clear idea that they are not educated, and many of them, they are illiterate because they didn't attend schooling, or they didn't go for any, like for you all, you all are studying some basic courses. Okay, you all are like practitioners, so they are not studying all of these things, so they don't have any idea regarding your topics. So because of that, the language that you use, the teaching method that you use to educate the people, it should be very short and simple. It doesn't need to be lengthy. Okay, lengthy and useless. It should be short, and it should be in a simple language. Next is aims of health education in schools. Okay, even in schools also these days, health education is provided to the children. Okay, firstly, to make students health conscious. In schools, it is required to provide health education to the children so as they can be conscious about their health. Okay, second is to set up a health standard in the school. Next is to provide information to the students, information regarding health. Okay, information regarding health, you have to provide to the students. Next is to take preventive and precautionary measures against communicable diseases. How to prevent, okay, and what are the precautionary measures that should be taken to prevent against any kind of communicable diseases? Communicable diseases, for example, what are they? What are the communicable diseases? You tell me, Kajal, what are the, give me some examples of communicable disease. Say fast. If you don't speak, then you can leave
Yes,
the
ma'am.
meeting. Tell me the examples of communicable disease. Give me at least 1, 2 example of communicable disease.
Um,
Communicable means what?
Ma'am, communicable meaning person to person spread.
To give me some example, just one example is also enough. Give me any one example of communicable disease. No example.
Ma'am, malaria,
Hmm?
malaria, AIDS,
AIDS. Then cancer. Cancer is a communicable or non-communicable disease? Cancer?
ma'am, communicable.
No. It is non-communicable. If I am having cancer, you will also have cancer or what? Just by talking with me?
No, ma'am.
Then how can it be communicable? If I am having stroke or shock, then you will also have stroke and shock. No, so these are non-communicable disease. Okay, it doesn't spread from one person to another. Communicable like your tuberculosis, measles, smallpox, all this comes under your communicable disease. Coronavirus, all these are communicable disease. The most recent one. Okay. Okay, next is to identify students with physical defects and health hazards and adopt remedial measures. So these are some of the health education, these are the aims of health education in schools, that why do we provide health education to children in schools. So these are the 5 aims. Next, aims of health education. This is in general. Okay, it is not for, it is neither for school. Okay, it is for people as a whole, to develop a sense of responsibility for health condition as individuals, as members of families and communities. That means they should have a responsibility of their own health, and for that you will have to give them basic knowledge, okay, to individual, to a single person, or to a family member. Okay, there in a family there it might consist of 3 to 4 people, 5 people, 8 people, 9 people. If there is a joint family, it can have it can have a number of 10 to 11 members. Okay, and if it is a community, then it can extend up to 200 to 300 people also. So you should educate these people so that they can have a sense of responsibility for their own individual health and how to keep themselves healthy. Because if you are healthy, then you can be free from various kinds of diseases. Okay, until and unless your physical being is healthy, then you are more prone to have diseases very quick. Okay, next is promotion, prevention of disease and early diagnosis and management. If someone is already suffering from something, like for example, if someone is suffering from diabetes, if someone is suffering from high blood pressure, okay, if someone is suffering from stroke, if someone is suffering from kidney disease, so if they already know that they are having these problems, if they are having this diagnosis, then you should ask them to go for regular checkup and also to take treatment. Okay, and also we should all go for regular health checkup. When we go for regular health checkup, we will be able to know if we are having any kind of disease of it, or if we are suffering from anything, and then we can take early precautionary measures. Okay, until unless we know what problem we have, we cannot take medicines, we cannot um, keep ourselves free from illness. Okay, so for that, early diagnosis and management is very essential. Next is to promote and wisely use the available health services. Okay, whatever health services that are available in the rural or urban areas, you should ask them to visit those places. Okay, even if the mother is pregnant, okay, if the mother doesn't go for regular health checkup, then if she is suffering from something, if she is having some kind of problem within, they won't be able to know, and by the time she goes for delivery, then it might be too late for the mother. So regular checkup is necessary. Okay, and it is essential. And And you already know that pregnant mothers should take TT. Okay, tetanus toxoid first dose. Okay, the mother should take the dose of TT1. Okay, and TT2. Okay, TT second dose also the pregnant mother should take. Okay, after the first dose. Okay, so next is to be part of all education and to continue throughout whole span of life. So these are some of the aims of health education. Next is these are the national control programs. In national control programs, there were three things to discuss, but I will be discussing only about tuberculosis and malaria. Okay, tuberculosis and malaria, and one more is their family welfare. Okay. Family welfare. So, in tuberculosis, you should know, okay, tuberculosis is caused by Mycobacterium tuberculosis. You should know this name, okay, Mycobacterium tuberculosis. Understand? You should know this. The tuberculosis is caused by Mycobacterium tuberculosis. And where does it affect? It affects our lungs. Okay, especially our lungs, and causes pulmonary tuberculosis. And sometimes it can also affect our intestine, okay, small intestine and large intestine. It can also infect our meninges. Okay, it can infect our bones, joints, lymph and lymph nodes, lymph glands. Okay, then it can affect our skin and other parts of the body. So meninges, I think you already know what is meninges. Do you know what is meninges?
No, ma'am.
Sachiphobia. Okay. We don't know meninges. So meninges is what? You have a brain, right? Everyone has got a brain,
Yes.
and you also have the spinal cords attached to it. So the meninges are the covering. Okay, it is the covering of your brain and spinal cord. Okay. And when you have TB, it affects that meninges, that covering, that membranous covering is being affected because of Mycobacterium tuberculosis. Okay. Next is skin, and what is that? Skin and other tissues of the body. What are tissues? Huh? What are tissues? Marbut Kiru. Say fast. Anybody knows? What are tissues? I guess you have studied about it. Say fast, I don't have that much
Ma'am,
MB. Sachi,
ma'am, group of cells.
group of?
Cells.
Yes. So a combination or a group of cells, okay, with a similar function and structure. Okay, together it forms a tissues. Understand? Together it will form a tissue. So there are numerous cells in our body, and all together it combines to make a tissue. So all these parts are affected when you are suffering from tuberculosis, but mainly it will affect your lungs, because here it is not, it is written as that this primarily affects the lungs. Clearly it is written lungs, but it can also affect, it can also is something like it might or it may or may not be. Okay, but lungs, out of 100% your lungs will be affected when you suffer from this TB. Okay, next, see all this. These are the, and the mode of transmission is mainly by droplet. Droplet, why? Because TB, while when you suffer from TB, the sign and symptoms will be coughing, okay, mainly coughing, sneezing, then blood in cough, okay, fever. So all these things are the sign and symptoms of TB. Okay, so whenever you cough, the drops that come out through the cough, okay, through that you can affect the other individual who is nearby you. That is why it is known as communicable disease. That means it spreads from one person to another. So a person who is suffering from TB should always use a handkerchief. Okay, when that person, because the other person might be unaware of his physical health. So because of that, he should take his own measure. He should always cover his mouth with a handkerchief whenever he coughs. Okay, otherwise the other person will also get affected. Why? Because it is a droplet infection. Okay, and so all these things you can just write. All these things will be there. Okay, you can check it out later. All these are not that much important. I have given, but it's not that much important. Okay, but you can study all this Zane, Nielsen, acid fast stain. So this is how the TB stains will be. Like you will come to, a person will come to know, okay, when he visits a doctor, okay, the doctor will send that person to technicians, and then they will do this test, and through this test it will be confirmed that a person is suffering from TB or not. So these are few steps. If you read, you will just come to know. Okay, because it is just a test. And from malaria, um, malaria is what? It is a protozoal disease. Okay, and the main, it is caused by Plasmodium. Okay, and the name of the mosquito is female Anopheles mosquito. This is the name of the mosquito, that is female Anopheles mosquito. Okay, so this causes malaria. A typical attack comprises of 3 stages. Okay, all at once you will not come to know that a person is suffering from malaria, or he or she might not be able to know at the very first place. So these are the 3 stages you will have to cross, and first is cold stage, hot stage, and the sweating stage. Okay, these are the clinical features of malaria. Through this, it will be confirmed that person is suffering from malaria. And the clinical features of malaria vary from mild to severe, complicated, okay, according to species of parasite present, the patient's state of immunity, the intensity of infection. Okay, in the, you just see the clinical features: cold stage, hot stage, and sweating stage. In cold stage, what happens? The onset is with lassitude, headache. Okay, first the patient will suffer from mild headache. The person might feel like vomiting. Then he might have chilly sensations. Okay, followed in an hour or so by rigors. Then the temperature. Okay, his temperature will increase rapidly to 39 to 41 degrees Celsius. Okay, there will be severe headache, and with along with headache, the person will suffer from vomiting or a feeling of vomiting. Okay, and in early part of this stage, what happens? In cold stage, the person will feel very cold. Okay, person feels cold for some time, and then suddenly the person feels hot. Okay, skin feels hot, cold for some time, and then after few hours, suddenly he or she will feel hot. Okay, then the pulse will be very rapid, okay, and weak. And this stage, this cold stage, it lasts for 1 by 4 to 1 hour. Okay, and in hot stage, what happens? The patient will feel very hot. Okay, in the cold stage, it was hot and cold and hot. But here in the hot stage, the person feels very hot. And because of that heat, he will feel like taking off all his clothes because of the heat. Okay, he will feel like taking off all his clothes. And then he will try to put the fan on. He will like to sit in an AC. Okay, because of burning hot in his body. The skin is hot and dry to touch. Even the skin becomes very dry. Okay, the headache is very, very intense, severe headache, and but nausea commonly diminishes. He will have severe headache, but the feeling of vomiting will not be present in hot stage. Okay, there will be no feeling of vomiting. The pulse is full and respiration is very rapid. His respiratory rate will increase or it will be very fast. And this stage, this hot stage will last for 2 to 6 hours. 2 to 6 hours, the person will be suffering from this hot stage. And in sweating stage, the fever will slowly go down. Okay, he was having fever here, right? But here, his fever will go down and he will sweat. Okay, he will sweat. The temperature drops rapidly to normal and skin is cool and moist. The person will feel like as if he is all right. His fever has gone down. Okay, his temperature has decreased. His skin is becoming like normal, cool and moist. Okay, like our normally how it used to be, the person will feel it in that way. The pulse also it becomes slow and patient will uh, at last feel sleepy because he feels himself that he is totally fine. And then this stage will last for 2 to 4 hours. And after this 3 stages, it will be confirmed that this person is suffering from malaria. He will undergo these 3 stages. Okay, so these are the differences between cold, hot, and sweating stage. This is the life history of malarial parasite. All these things we will discuss the next class. Okay, now meeting time is getting over. Okay then. Mm, I will be taking your class at 1. Do you have class?
Yes,
So,
ma'am.
Srijana, huh?
Ma'am.
Yes,
You
ma'am.
have class at 1
Yes, ma'am. Physiology practical.
and 2.
No, ma'am.
Okay. If possible, I'll try to take at 2 also, huh? Because yesterday I was not able to take class.
Okay, ma'am.
Okay. Okay. And you start uploading your mark sheets in your this one portal. Have you got your mark sheets, Srijana and all?
Yes, ma'am.
Ashri also, you check it. Okay, I have sent you. Ashri Debarma. Okay.
Ma'am,
Hmm.
we got of first sem only. Then I uploaded to first sem only. Second sem I did
Yes,
not
yes, it's
got.
okay. Hmm.
Okay, ma'am.
First semester only you have got, na? You upload that one. For your
Yeah,
second,
ma'am.
you will get it very soon. Still, we have not got your mark sheets. I only got your first semester mark sheet.
Okay, ma'am.
Okay, okay. You all can leave the class.